the meeting, the recording. And thank you, everyone. Good morning for joining. Thank you, everyone. Good morning for joining us. That's not quite right. Good morning, and thank you. Not enough coffee and not enough sleep. So really appreciate, once again, Jennifer Burkardt joining us this morning. She does serve on the EDC board, and we're so thankful for that. And especially now, it's so important to hear about what's happening at OMC because they are such a critical component of us being able to move through this public health emergency. And they also happen to be the largest employer in the county. So there's lots of reasons why they're very, very important to the EDC. So we're really thankful that Jennifer was able to join us today and give us an update. So Jennifer, if you would, go ahead and take it away, and then we'll open it up for questions from anybody. And if you have a question, you can put it in the chat, or I will be happy to call on you, or you can raise your hand. We're pretty flexible. This is a pretty informal coffee chat here. But thanks so much, Jennifer. Go ahead.
Great. Thank you, Colleen. I really appreciate the opportunity to talk a little bit about Olympic Medical Center and share with you an update about healthcare in Clallam County. And it's great to see all of you. So good morning. We're in the midst of what we have determined is probably the second surge of COVID-19 in our county. We had been preparing all fall for the big surge. And as we look at the numbers, we believe that really we're right in the midst of it at this point. Even though our rate of prevalence in Clallam County is not as high as other counties across Washington state, we've seen a fairly concerning increase over the last few weeks. When I talked to this group in October, we were at approximately 50 instances per 100,000 of COVID-19, and that has quadrupled to today it's 196 occurrences per 100,000. That's down just a little bit this week, so we're actually seeing that we potentially are starting to get it under control, but we don't know what the next few weeks will be. So we're really predicting the potential of a difficult holiday season. We have 7 people hospitalized currently, and our ICU is very stable. We've had capacity. We do hear that across the state, the ICUs are more than 80% full, and for that reason, we all heard that the governor yesterday has extended the business closures and the social gathering restrictions through January 4th. So that does give us some insight into the potential that the next few weeks could be fairly difficult. But we've been doing a lot of surge planning all along during the pandemic. We had ordered additional hospital beds. So where we were set up to receive 67 patients previously, we're now up to 83 beds for our hospital. And we have plans in place to convert the south portion of our emergency department into an airborne illness unit. So that would be entirely blocked off, and we would then activate the additional beds on our second floor as well. So we have some pretty thoughtful plans in place in the event that Clallam County sees a tremendous surge. So Colleen, you asked about the vaccine, and that is the headline news at OMC. We've been preparing to receive a big shipment of vaccine from Pfizer, and we're hearing that we will receive 975 doses, and those are set to ship to OMC just as soon as the approval comes in from the FDA. So we've seen some very encouraging early analysis from the FDA that indicates approval is highly likely. We know they're scheduled to meet tomorrow, December 10th, and we're looking forward to hopefully hearing approval possibly as soon as this weekend. That means that we could see our delivery as early as next week. We feel very fortunate at OMC that we were able to secure one of the ultra-low freezers that stores the vaccine. And what that does is helps us to maintain the vaccine for up to 6 months. This particular vaccine from Pfizer will only stay good for 5 days on ice. And if you refresh the ice, it can be maintained longer than that. But with an ultra low freezer, we have longevity in place where we can store it and continue to roll out the vaccine over time. So we've been making a lot of plans to roll out an immunization clinic for our staff just as soon as the vaccine is on site. We are setting up a location. We're hiring additional staff to administer the vaccination. We want to do it on an expedited basis to roll it out just as quickly as we can. With 975 doses expected initially, we are expecting that we'll have enough. We'll have a sufficient amount to offer vaccination to all of the employees on our phase 1A list. So Human Resources has worked with our clinical staff to develop a phase 1A list that includes those departments that you would probably expect to be prioritized: the emergency department, our anesthesia providers, the intensive care unit, our hospitalists, walk-in clinic, other clinical staff. So that's about 500 to 600 staff, and we will still have additional vaccination resources for others at OMC. And we are preparing potentially to offer it to those in the community as we partner with public health. And at this point, we're hearing that we will offer it to EMS staff and other first responders who are prioritized. The long-term care facilities are on a separate federal distribution plan. So although they appear in the phase 1A list, we're hearing that they'll be covered by the federal program. So we're very optimistic about this, particularly because we're hearing that we'll receive a second big shipment of the vaccine by December 31st. And then beginning in January, we should be receiving a shipment of vaccines every week. So that sounds really hopeful to us. One of the challenges with this is that the Department of Health is recommending that we stagger the vaccination. So we don't want to have entire departments that have the vaccination administered in the event that staff might experience side effects, and we would have the potential of having staff out of work. And so what we are planning right now is a fairly sophisticated staggering system where we will deliver the first dose of the vaccine across a certain number of departments, but only a percentage of those departments. And then with the second dose of the vaccine being administered up to 21 days later, we'll be able to monitor the symptoms and see how it affects our staff. We're hearing that the effects are reportedly a bit greater after the second dose, but we're just being as careful as we can so that we protect the staffing in our key departments. So we're really optimistic given the freezer storage capacity that I mentioned earlier and what we're hearing regarding the shipments. So very hopeful that this provides a light at the end of the tunnel, and we'll keep you posted as we hear more about it. So what is not quite as bright of a picture is the COVID impact on our local business community, and that includes OMC as well. So I thought I would provide an update to you on the financial status, which unfortunately has been affected. Our employees have been wonderful. They've continued to work throughout the pandemic. So we have a lot of very, very hardworking staff. I will say there's a tremendous amount of fatigue. And so we're doing everything we can to try to support the staff and keep them going during this difficult time. We've seen a pretty big hit to the budget in terms of COVID expenses. So to set the stage, OMC has an annual operations budget of $240 million. Our payroll every 2 weeks is $4 million gross. With 1,600 employers, we really try to contribute to we try to contribute to the local economy. So the dollars are important. When I spoke to this group in October, I reported that September was a break-even month for us. And so that was actually very encouraging and positive. The situation for October was not as good. In fact, with COVID-related expenses, we lost $1.7 million. And that's a huge hit for us in 1 month. We were looking very carefully at the expenses that hit our budget in October, and they were related mostly to the drive-up testing that we've been offering the community and our employees and our patients for COVID. The cost of the labs is tremendously expensive, along with the reference testing and courier fees in order to shuttle the testing back and forth. And then we've also added extra emergency room staff in order to have sufficient doctors and nurses available in the emergency room if we do see a surge. So our chief financial officer did an analysis just yesterday for the year, and she determined that the costs that are directly attributable to COVID for OMC so far this year are $6.8 million. And her estimate is that we may top $9 million in direct COVID costs by the end of the year. The last time I talked to this group, I spoke a bit about the CARES Act funding. And unfortunately, an update on the CARES Act funding is that since that time, we've seen a series of restrictions being issued by the federal government. And as the restrictions become more and more narrow, we're concerned about applying additional CARES Act funding to our deficit. So we're working with some of our federal legislators to do a few things. One of them is to ask for a bit of leniency with the CARES Act regulations that are coming out now, because as I said, they're really impacting our ability to access any of those funds. And we're also working on potentially reversing the site neutral cuts that we've seen go in place under our previous administration. And now that that's changed, we're really hoping that we would be able to make progress in reversing those cuts. That's a $47 million payment cut over 10 years for OMC. And the local impact of that is that we've been really hampered in our ability to expand in SQUIM. We had a $5 million primary care clinic expansion that was planned that unfortunately had to be put on pause for the moment with those site neutral cuts. We also had a $10 million ambulatory surgery center plan for SQUIM across the street from our medical services building there on Fifth Avenue. And at the moment, that's also on hold because of the concerns about reimbursement and the ability to sustain that. We did go ahead with a $5 million expansion of the cancer center this last year. We really determined that that was necessary because of the cancer center services in SQUIM and the needs that we've seen in the community. But those projects are ones that we probably will have to continue to pause unless we can really move forward in reversing those site neutral cuts. So we're also working on some initiatives around the Medicare advance payments that hospitals have received. Those are intended to be loans, but there's a potential that the federal government ultimately might allow hospitals to retain some of those funds. And if that's the case, then we would want to utilize them. If they have to be paid back immediately in the next 6 months or so, to us, that really creates a difficulty because we don't know what the next 6 months will hold for us. So the uncertainty around the Medicare advance payments really cause restrictions on our ability to utilize those funds. So despite all of those challenges, you can tell we have a lot of work underway to try to secure reimbursement on the federal level, and our finances are, they are fairly solid. We've always been very conservatively managed, so the financial situation remains solid. I will say that one of the big factors for that is our Medicaid reimbursement. Our local legislators have worked really hard to secure an enhanced Medicaid payment for OMC and for Grays Harbor, which faces even more financial difficulties than OMC does, frankly. That's been really helpful. It's still only 70% of our costs, but starting in 2014, our local legislative team passed a bill that provided for Medicaid payment that was helpful to OMC. And in the last 2 years, Senator Vandeweghe, Representative Chapman, Representative Theringer have all worked together, and they're such a good team. We've been so appreciative to put a budget proviso into place regarding that Medicaid enhanced payment. So we're really hopeful that that will continue. It's set to expire in June. And so that's been one of the things that's allowed us to remain stable throughout the pandemic. And of course, we're tremendously appreciative for that. So a quick comment on workforce. We have 1,600 employees, as I mentioned earlier. They're all working really hard. It's been almost 9 months that they've been working day in and day out. Our employment has held steady. We're remaining at 1,600 employees. We added 52 employees last month, but we also see retirements and some degree of attrition, so that's why that number has remained stable. We have not done any furloughs. We've not done any layoffs, and that's been actually a great recruiting point, particularly for our providers. We've added 20 providers, physician and advanced practice clinicians, since the pandemic started, which is really a big number for us. And part of it, our provider recruiter says, is because of the story that she's able to tell about the stability of our community, that we've fared better than most during COVID-19, and the fact that OMC has remained stable, that we haven't engaged in layoffs or furloughs, where most hospitals have done that to at least some degree, and many providers have actually been let go and they're seeking new employment. So that's been really helpful for us. We've been able to add to cardiology. We filled all of our advanced practice clinician spots in primary care. We've added a wound advanced practice clinician. And so that's been really helpful. And we're continuing to keep our services at a high rate going forward with the providers. Right now we have 163 open positions. That's even more than I reported when I talked with you in October. It's up by about 10. Our vacancy rate has been pretty constant, and we still have the same positions that we're recruiting hard for. Of course, registered nurses, medical assistants, certified nursing assistants, surge techs, and a whole host of other positions. We're looking at market increases for those staff, actually all of our non-union staff over the next month, and really trying to make a huge effort, a big push to recruit and retain our staff. So our supplies of PPE have continued to be constant. We have a goal of about 90 days on hand for all of our PPE. That has been an ongoing challenge, but it's something that we've been able to maintain. And with all of the partnership that we've had with public health and with our local legislative team, with Forks Hospital, Jefferson, we really feel positive about being able to continue to serve the community. The immunization news, the vaccine, is really, as I mentioned, the hopeful light at the end of the tunnel. These are all challenging times, and as you can tell from this description, we have a number of challenges that we're working through, but we're very hopeful at this point and really feel like working together as a community, we'll be able to get through the next few weeks and then the next several months, and hopefully have the vaccine in place and broadly available. So thank you for the opportunity to provide an update, and I'm happy to answer questions.
All right, terrific. Thank you so much, Jennifer. It's a really comprehensive report that you provided. And a lot of interesting things that you shared, especially I think about the vaccines that are coming, 975 doses being shipped. Do you have any understanding of what the total amount would be to our county for the long-term care facilities and that kind of thing, or are you just aware at this point of what's headed to OMC?
Those are the only numbers that I have access to now. We did hear that the federal distribution plan is very comprehensive for the long-term care facilities, but I don't have the specific data on that yet. We're learning more every day, I will say. There are bits of information that come across, it seems like minute by minute. So we're meeting as an incident command team every other day at this point because there's so much evolving.
Mm-hmm. So, and I see Debbie Fusen has a question. Debbie, if you want to go ahead and ask.
Yeah, I'm wondering if the vaccine will be mandatory for job retention for your employees.
It is not mandatory. We will make this a voluntary process for our healthcare workers. We have strict adherence to PPE in place, and so those requirements will continue, and we are confident that we'll be able to continue providing safe care with the PPE requirements in place. We don't know how many of our staff will actually want to voluntarily take the vaccine. Interestingly, Jefferson Healthcare did a survey of its staff recently, and they're expecting about a 50% volunteer rate. Which is lower than I would have expected in healthcare, but also I don't know how large the sample size was for their survey. We're not going to make it mandatory. We made that decision early on. It will be voluntary, but we'll be continuing to ensure that the PPE is in place so that all of the protections that we've had throughout the pandemic will be present.
I'd like to extend this question to Mr. Chapman and the other representatives, because I'm hearing rumblings in Oregon that they are going to make it mandatory through the legislator. Oh, forget it. I'm not talking well this morning, not enough coffee either. And if they make it mandatory in Oregon, will we follow suit?
Yeah, I've not heard any conversation around the vaccine being mandatory. First of all, I think it'd be impossible to police or enforce. And also, the New York Times has a chart on their website, you can plug in kind of where you are on the vaccine list. So there's 245 million Americans before I would ever get a vaccine. So I don't know how you make something mandatory that's not going to be available right away. But it doesn't mean somebody won't drop the bill. But it is not. We just went through our little pre-session meeting, and mandatory vaccine was not on the priority list. And we really pared down the priority list for this session. And in fact, legislators are limited to the number of bills they can drop. So I don't think you'll see a lot of superfluous bills, but it doesn't mean one won't come forward. But it's not on the topic that I've heard. I think it'd be impossible to police anyway.
So Jennifer, thank you, Representative Chapman. Jennifer, you mentioned that the statewide average for ICU, what do you call it, occupancy or use is, 80%. What is it at OMC currently? Do you know?
We fluctuate between about 40% and 60%, but we also are not utilizing any of our surge planning at this point in time. So that number would actually be, we would have more capacity if we activate that surge plan that I mentioned regarding blocking off the south part of our ED, and then we would open up the additional beds on our 2 East part of the hospital. So we have a really good amount of capacity. It would be higher, as I mentioned, if we went into that phase of the surge plan.
So what typically is the level when we're not in COVID? How many people are typically in ICU at OMC?
Well, you know, interestingly, we really haven't seen a higher utilization of our ICU. So it's remained relatively stable. We've been monitoring those figures really closely year over year for volumes in all of the areas. And we're down just a little bit actually in hospital census year over year, which is kind of interesting also. And the volumes in the critical care areas and the ED are relatively stable when we look at last year. So even though we've seen an influx of COVID, again, Clallam County has fared better than most, and we feel that we've been very, very fortunate with that. And part of it is that the community has really come together to, you know, take precautions, masking and leadership, like our business community, and Representative Chapman has been out there in the forefront saying we should mask. And I think a lot of those initiatives have really led to a low prevalence rate.
Mm-hmm. So Steve Bierman asked specifically, what is the ICU capacity today? I think you said 67?
We have 67 beds total in the hospital, and I actually got the report for this morning and haven't opened it yet. So I would have to get back to you. I know earlier this week we were about half full for our ICU and our telemetry unit. Those are combined. And I'd be able to provide the specific numbers once I go into the report. And I apologize, I haven't checked it for the day.
Oh, not at all. Mike, or also I see Hospital Commissioner John Nutter is on with us. Is there anything that you guys would like to share in regard to this topic?
I'll just share. We met with, so Steve, Kevin, and I met with the Grays Harbor representatives of Grays Harbor Hospital and OMC, and they raised the issue of this Medicaid reimbursement rate and the direct payment. Both OMC and Grays Harbor Hospital fell under the legislation, and we were able to get a direct payment the last 2 budget cycles. There are a couple of hospitals in Eastern Washington who have noticed that Grays Harbor and OMC have received this extra payment, and they're kind of squawking. But I think we're going to be okay. In initially with the recession and the pandemic, it was, and we were thinking there was going to be a kind of a larger influx of federal money, but I think we're going to be okay in keeping that reimbursement rate. The question is, do we expand it to all the hospitals that would be eligible? And that's what some of our friends across the other side of the aisle are upset about, because they're in districts that are held, you know, represented by the other party. And so I think we're going to have to maybe come up with a formula based on need. But certainly Grays Harbor, without this reimbursement rate, Grays Harbor Hospital probably would have closed their doors, which you can imagine how devastating that would be. And so that's almost like a no-brainer. But OMC is also right up at the top of, because of the kind of the attack of the federal government. That hasn't reversed yet. I think we're hopeful that it might reverse. These dollars are going to be really important. So I think Steve and Kevin both serve on the healthcare committees in the Senate and the House, and they also both serve on the Appropriations Committee. So they're in a prime position to continue this funding. It's not a given, but it does look better than it did just because of the economy somewhat recovering. And so.
So thank you, Representative Chapman. Jennifer, I see there's a question in the chat. Will there be a cost at the local level for the vaccinations other than the labor, PPE, and syringes? And how long will the hospital be the lone administrator of the vaccine?
My understanding so far, and things do evolve, like I mentioned with the CARES Act funding, we saw restrictions that came out after the funding. So what we're hearing at this time is that there will not be a charge for the vaccine to the hospital. If there is, we are ready to and prepared to cover that. But at this time, the actual vaccine does not have a charge that is associated with it. And as you mentioned, Connie, the labor, the administration of the vaccine, and some of the logistical costs associated with it will be borne by the hospital. I don't know that OMC will be the sole distributor of the vaccine. In fact, again, it's an evolving situation, but my understanding is that we would have further distribution through public health and definitely through that federal distribution plan that I mentioned. So we're, again, hearing bits and pieces as this comes together and is finalized, but I don't think we'll end up being the sole provider of the vaccine. Probably a major provider. That ultra low freezer that I mentioned, again, we're so fortunate that we were able to secure that. That's one of 2 in Clallam County. And the other one, we need to talk to public health about it, who has that and what they plan to do with it. Again, those discussions are ongoing, but there are 2, to the best of my knowledge, in Clallam County. So that really is good news for our rural county.
Mm-hmm. So do you know if Jefferson County also received the ultra low freezer? And if so, was there any charge for those?
I'm unaware, actually, of Jefferson County at this point. We've just received that news ourselves, and I would have to check on the cost. I just don't know the answer to that.
Okay. And Commissioner Nutter, do you have anything you wanted to share?
No, other than I'd really like to commend the staff at the hospital. This has been a very trying 9 months, and vaccine coronavirus fatigue is very definitely a real thing. And the hospital staff has really stepped up and just stayed in the fight the entire time. And I also give a lot of credit to the administrative lead team at the hospital. They are a very strong leadership team. We had weekends where we needed to staff the drive-through clinic to get testing done. And due to staffing constraints and lack of staffing and union issues, every single member of the administrative lead team came in on their personal weekend to staff that themselves. And so they have stepped up in a very big way. So
did hospital commissioners show up too on weekends?
For some reason, they didn't invite us. Apparently, we're not qualified to put swabs in bags and things like that. But anyway, so no, just my hats off to hospital staff and leadership for really doing an outstanding job during this time.
That's great.
They've done a great job.
Mm-hmm. I did put in the chat a link to the New York Times article that you can plug in some data about yourself, and you can find out approximately when you would be able to receive the vaccine. So I know you're just getting information, and but from what I understand, where would someone find out, like priority 1A, you reference 1B,
Mm-hmm.
those different categories, when the general public will be able to receive a vaccine? Where would they go to get that information?
The lists aren't even finalized yet, so I can't answer that, but we can stay tuned and obviously provide some more information. I know that HR, as I mentioned, is just producing the list of employees by job classification today for our internal staffing. and we'll be reviewing that very closely to make sure that none of the really urgent areas have been missed. So that's our first task, and that's actually starting this morning at 10 a.m. I'll be working on that list. So that's not been finalized. The phase 1A and phase 2, so forth, the criteria is laid out, I believe, by Department of Health. So we have the basic rubric for what it will look like, but that doesn't tell every person where they would fall in that. So I think we'll just have to continue to monitor that, and more information will be forthcoming.
Mm-hmm. Great. From the workforce standpoint, I know OMC has a strong nursing program, but do they also have a medical assistant? And you mentioned surgeon tech, I think, and was it CNA? Mm-hmm. Do they have programs in all of those categories?
Yes, I'm so glad that you asked that. Our surgical services director, who has actually stepped up as our interim chief nursing officer right now, has developed a great process for training our surgical techs. That was an area where we're really hard pressed to recruit. And when Luke Robbins was on recently, he mentioned that the college is looking at a rotating program with 2 other community colleges where they would train some job classifications, including surg techs. That hasn't happened yet. We're highly in favor of that and hope to see a program like that come into place at some point. But right now we're training our surg techs internally. We have an MA apprenticeship program, which is a fantastic program because those who are hired into the spots, and it's every 6 months we have a new class begin, are then trained on the job. So for a lot of workers in our community who really need to continue to have an income while they're learning and going to school, it helps them to bridge that gap because they have a job, but with Peninsula College aligned with us and with our on-the-job training, they can then go through the program. With certified nursing assistants, it's a really timely question because I had actually just raised the question of what can we do to train our CNAs in-house? We don't do that presently. Some of the long-term care facilities do, and there's a great program at Peninsula College for CNA training, but we're wondering, do we need to bring that in-house? I don't necessarily want to be redundant of anything that Peninsula College is offering, but if we need to do an on-the-job training scenario, I think that's something that we can look at. We have really helped staff move from dietary and housekeeping and other positions up to CNA positions by allowing them to be trained while they're in their former job classification. But that's been a fairly informal program over the past few years, and I would like to see us formalize that more. And then our registered nurses that you mentioned, we have a really nice formalized residency program that our education department has developed under our director of education's purview. So that's been fantastic. The feedback from nurses is that they really feel like they get to have the opportunity for skills and training on the job, so they feel much more ready to deliver nursing care as they go into their full-time role.
Mm-hmm. Great. Can you characterize the wages, the starting wages, and then kind of the range for these different open positions, especially medical assistants, MAs, and certified nursing assistants, CNAs?
Yes, I can. Right now, we're actually looking at our medical assistant wages. I think I mentioned that we're going through our compensation cycle. And the present entry wage for the MAs registered, it's fairly easy to become a registered MA. It's essentially a form that's filled out on the state website. Those starting wages are approximately $15 an hour. The wages for an MA certified, which is a little bit more of a process, and then they have a higher level of skills and duties that they can utilize, is about $17 per hour, and I'm speaking very roughly. What we'd like to do is actually increase, particularly the MA certified rate, the higher end rate, to closer to $19 an hour or so over the next month. So we're really looking hard at probably a 15% increase for that group of workers. because we need them so much. And the market's moved. I mean, we've tried to stay at market, but just looking at the analysis for the last year, our local market, we have other healthcare organizations, our partners, who also hire away MAs. And then regionally, we've seen an increase. CNAs is approximately the same wage rates. And we're going into bargaining with SEIU, that's a unionized group, to increase those wages in February. So we'll see an increase there as well.
Okay, great. Lindsay, would you like to ask your question? One?
Yeah, hey, thanks for this. This is really great, and I'm learning a lot. I was wondering, it sounds like 160 or so open positions is about 10% of staff. I assume that's higher than we want it or is normal, but I could be wrong there. And if it is, what are the barriers to filling those positions? Is it training? Is it wages? Are there other factors? I think housing might be part of that answer, but I don't want to presume.
Yes, Lindsay, thank you for that question. You're absolutely right. First, I'll speak to the statistics. It's higher than I would want to see in terms of a vacancy rate. However, when we look at the figures nationally, we're actually not higher than most healthcare organizations. There's a shortage of healthcare workers across the country. So even though we're in a rural area, we have a fairly good level of recruitment when you look across at other comparators. That being said, we do have some big challenges because of our rural environment, and you mentioned housing. That's definitely been something that we have heard from candidates as they consider coming to the Pacific Northwest and the North Olympic Peninsula. The affordable housing issue and also affordable childcare is another issue that we have in our county. There's really a deficiency in the amount of childcare that's available. So we hear that from our staff. And I know I've been working on some task forces recently to try to increase the robustness of offerings in our county. In addition to that, I think just trying to maintain our market wages. We really try to stay at market, but frankly, we're not on the I-5 corridor. And when you look at the reimbursement that OMC receives as a rural hospital, we have a payment mix of 83% Medicare or Medicaid reliant patients. And that's a big reliance on government payer. As opposed to in the I-5 corridor, you might have a hospital with approximately 50% commercial and perhaps 50% government payers. And so there's an ability for some hospitals in the urban areas to really offset the below cost reimbursement from government. So that's a challenge for us, trying to maintain our independence as a local hospital. We really want to maintain that locally owned and operated status, but doing so requires financial stability. Keeping financial stability requires, looking constantly at the finances, and wages, labor are our biggest expense by far. So all of those factors, I would say, make it an ongoing challenge. I was really encouraged, though, by our provider recruiter telling us stories of the interactions she's had with providers and being able to recruit so many providers, because she feels like the story is really a good one of a thriving community, even despite the pandemic. And that's a pretty amazing story to be able to tell in the current times. So I think the ability for us to recruit will only get better. And as Colleen was asking about, the in-house training and the partnership with Peninsula College has been just huge. And our local legislative team there also has secured state funding in the past for expanding the nursing, CNA, and MA training spots at Peninsula College. So that's been fantastic to see that we have that training available to those in Clallam County. You had mentioned, is it a skilled workforce issue? And I would say that yes, a big part of it is that many of the healthcare worker jobs do require specific skills. To be a surge tech does require an awful lot of training, but it's there, it's available in-house. It's just how do we offer that and leverage it so that people know it's available, they get in the door, and we're able to sustain that program.
The chambers have done a fabulous job over the years of doing in-person job fairs. Got Angie on here, and I know they've been really involved with that, and they've been very successful. And this this year on August 13th, we had a virtual job fair that Employment Security Department pays for the platform that is used, where I think we had 44 booths with businesses and childcare resources, that kind of thing. And we've been trying to get another one set up, but since ESD is having to pivot and the work source offices and people locally have been having to work on unemployment claims, we have therefore been kind of pushing back the date of when this next virtual job fair will be. So I just wanted everybody to know that we're working with OMC and the chambers and NPVA and others to try to set up a job fair, and they've told us hopefully it will be January. So that date keeps on getting pushed out, but we are really trying to get something set up so that the community can, and the employers can let people within the community know, and even outside of our community, know about what job offerings are available and try to make some of those connections. My dad, Mike McAleer, had a very good question. Mike, would you like to ask your question?
Yeah, I don't know whether this is a Mike Chapman question or a Jennifer question, but what is the process? Who's involved in managing the vaccine distribution after the first group, the healthcare folks and the long-term care providers? What's next, and who's in charge of that?
So Mike's not answering, so I'll try. My understanding, and again, we get evolving information, but the CDC in conjunction with the Department of Health has been putting out the guidelines for the phase 1A grouping. And we're, in accordance with our public health locally, working through that list to apply it to our workforce. Beyond that, I think some of it is still evolving, and I don't know for certain how that will all play out.
Yeah, I think the governor is also working with, I mean, the federal government's trying to put a plan together, but generally thus far during the pandemic, so much of the state supplies have come through the emergency management folks. Now, I don't know with the vaccine, how that will work. Also, I've read in the Wall Street Journal yesterday, Walgreens and Rite Aid and other pharmacies are going to be integral in distributing the vaccine. So I think there's going to be a private sector component to this as well.
Will there be any kind of, like when you go vote, you've got a little vote button. Will there be any consistent, I've been vaccinated button so that people could wear that? And just, I think from a public relations standpoint and a confidence standpoint, and that people would see other people in Safeway or Costco wearing these, and is there a program established, something like that for the public?
I'm not aware of one. I know that we've had actually difficulty at OMC having notifications on our badges related to flu immunization and the like, because employees frankly have some privacy interest, and our unions have objected to that. So it's not something that we've ever required. Whether or not there would be some kind of state or federal program related to that, I'm unaware.
Okay. On a volunteer basis, it seems like that might be an option if there was just a little button. I would think that might.
I've read that, well, the private sector is looking at this, and there was a question earlier about mandatory vaccines. It may not be mandated by the government, but I believe you're going to see airlines ultimately are going to mandate that you're going to have to show proof of vaccine before you're allowed to fly, at least international, and other countries will mandate it. So I think there's going to, much like Costco was one of the first retailers to step up and require a mask before, they were requiring a mask before it was a mandate statewide. So I think, and there's also, I think some of the tech companies are looking at some sort of bracelet, but I've heard before you could go to a Seahawks game in the future, you'd have to show proof you were vaccinated, and then that's how people, I think government will work through that, that ultimately that's how we can reopen some of these events that we're missing out on. So I think it'll be but I don't think you can mandate it. I think it's going to be, the Seahawks are going to say, if you want to go to a game, you're going to have to show you're vaccinated. I think that's within their right as a private organization.
And I would think too, people that are excited to get vaccinated and feel confident about that might want to, share with others that they've done that. I think of it similarly that I voted. You don't have to take that little voting sticker, but people are proud that they did that as kind of being part of a society of public purpose. And that's just my opinion. Could be wrong, of course. Does anybody else want to add anything? We've got Terry Ward on, or Mike, are you? Great, go ahead.
Just on the current conversation, possibly being able to, an encouragement to get a badge like that would be not have to wear a mask.
Mm-hmm. We've definitely talked about that internally with our flu immunization policy. That's exactly the case. We have a choice policy where a staff member can be immunized or they can wear a mask. We're wondering how that will all work out with the precautions that we have in place now, because we've had such strict adherence to the PPE requirements, including masking. So not sure that we would be able to waive that for an immunized staff member. But we continue to look at how do we make this more attractive and more appealing to our staff member to be immunized, because we'd like to see as many as possible. So not a bad thought, and we just have to keep looking at the standards and make sure that we're in the strictest adherence category as healthcare workers.
And I guess I was thinking more along the lines of Safeway or Costco not having to wear a mask there.
For the public.
Yeah.
Lindsay, you have another question?
Oh, I apologize. I'm speaking a little bit beyond my knowledge of virology, but there's a concept of whether the vaccine will make you immune to the virus, or will it kill the virus in your system so that you're not a carrier, even though you're not showing signs and symptoms and you're self-immune. I think that's called sterilizing immunity, but again, somebody else may remember this or know this better than I do. So I apologize if I've just misspoken. But if it is not, that's kind of sterilizing immunity, one might still be potentially a carrier of the virus and thus might still want to wear a mask in public. Again, I'm probably asking questions and speaking beyond my level of knowledge.
Is there a time frame after you're immunized that, especially if you get the second vaccine from Pfizer, that you would have, you wouldn't potentially be a carrier?
Were you asking me, Colleen?
Anyone, yeah.
Sorry, I don't know the answer to that that Lindsay just described. I think that we will be looking at the analysis. That analysis that came out yesterday of the Pfizer vaccine was very lengthy, and I actually took a look at it, but didn't get through the entire analysis. So I probably rely on my clinical experts to tell me the answer to that ultimately before we would have any precautions removed or reduced at the hospital level.
Mm-hmm. Thank you. It's an interesting issue to consider. And Brendan, see, you've got a comment. He said that they'll be selling tickets and vaccine badges outside the stadium, I guess. All right, well, does anyone have any other comments or questions they want to ask? So Steve asks about the non-Pfizer vaccines.
Yes, what we were told is that initially we would receive one or the other of the various vaccines that are available. So we are only in the pipeline for the Pfizer vaccine, but as we all read in the news, there are a number of other vaccines being developed, and they're just right on the heels of this. So we expect that those will be more widely available. right now we're essentially being dictated to as far as the supply. And so that's what we've been informed, is that we would receive only the Pfizer vaccine. But we're optimistic and looking forward to the potential of that being more widely distributed.
Mm-hmm. Great.
I think it's safe to say that in the legislature this year, through the healthcare committee, I suspect some of these questions will be worked out because this is going to be COVID relief is one of our priorities. And so both economic relief, but also the healthcare relief, and also funding reimbursements to hospitals. So I think some of these questions, I think the state legislature will be playing a role. Right now, the governor's kind of taking the information that he's getting, but ultimately all of that information is going to disseminate through the legislature. And I could see policy budgets being written to help in this dissemination and kind of determining who's going to help prioritize. I mean, I don't know that we just rely on the New York Times to determine exactly the prioritization in our state. So I think that there'll be some, that is one of the 4 big priorities for the legislature this year, as soon as we're back to work. So I think it'll be important, you know, Jennifer and the OMC team will be monitoring legislation and will be weighing in as well as the other providers locally in their association. And you guys don't know, I mean, Eric Lewis now works for the Washington Hospital Association. So he's going to be, you know, intimately involved in helping to craft policy and help us write a budget that doesn't slow this down. The last thing we would want is a budget or policy that we have vaccines backing up in the pipeline because we don't have the ability to disseminate it. So I can even see through the emergency management folks, a special one-time part of the COVID relief fund of helping, you know, they're going to have to hire more people to get this. And so this is just going to be front and center along with the economic recovery package that we're going to work on.
Hey, Mike, you know, going back to the mandatory vaccination, basically what you're saying is the Seahawks can't function as a business and we can't be fans and attend a game unless we have a vaccination. Why can't we have the same option of wearing an N95 mask into the game if masks are so effective? Just like the hospital has the availability to have PPE instead of the vaccination. I've had very adverse effects to vaccinations, and so has my son, who is his immune system is compromised by diabetes, and he took the flu vaccination and got so sick and 105 fever after the vaccination, which was worse than, you know, if he hadn't had it. So that's why I am asking all these questions about the mandatory vaccinations, because we really don't know what's in them. But, you know, I'm looking for options for businesses to function and get back up and getting some semblance of normal, that we can go on with our lives and meet with our families and etc. without having to carry a card that says I've been vaccinated.
And you raise really good points. And one thing that will, because most of our session, if not all of it, will be through this component of the Zoom format. So what you're saying is through the legislative process, people like yourself who will now be allowed to call in via Zoom and testify will be raising these issues. So right now the governor has been operating under his orders, but we know that through the legislative process that there'll be lots of input. And you raise really good points. If you did a public records request, you would see that so many of my emails right now on COVID are about not making sure there won't be a mandatory vaccine. This district is, and Jim Stauffer will know the debate over the vaccine requirements for schools. I mean, I would say that this area is not 100% keen on vaccines. And so right now I'm replying to people trying to assure them there won't be a mandatory, but ultimately we've got to find out, whether it's through herd immunity, vaccines, and masking. We're trying to get back to an open society and an open economy. But I think the public hearings on some of these issues during the legislative process, and because now the public can dial in from anywhere, will be really robust. And I think that if nothing else, you're going to have a more open and free open government, that you don't have to drive to Olympia to testify. But you raise great points. Like I said, I have lots of emails raising those same points. So, and I don't have the answer other than it's a combination, and we know not everyone would be vaccinated. We know that. I've seen the statistics. You all have too. It looks like up to 40% of Americans wouldn't take a vaccine right now.
So, Mike, at yesterday's press conference, the governor stated that if Congress doesn't act, the state would fund additional pandemic-related unemployment insurance benefits for a month. But he didn't indicate how that would be funded. Can you shed any light on that?
I think he's still looking at the part of the $200 million COVID relief fund that we allocated before we left in March. And that's where that's the work that we've done. ESD's really been struggling. They're still struggling, but I think that there's some leftover funds there. And ultimately, we'll have to shore up that account one way or the other. There's thoughts of some short-term borrowing. We can't raise the rates so the law says what the rates would have to go to. Through a previous number of years ago, the legislature kind of set this up with a piece of legislation. So we're going to have to change that to make sure we don't obliterate businesses with the rate increases as well. So that is also one of the huge priority, and trying to get a handle on ESD, which is still not functioning the way it should be, unfortunately. But it's not an excuse. It was a system set up for an average of unemployment between 5 and 8%, and it went to 30 to 40 overnight. So they've really struggled to manage that workload now. That's not an excuse, and they've had 9 months, but we know we'll be funding short term to keep the increases on business to a reasonable number.
All right. Thanks for that, Mike. Well, it looks like we are moving up on the 9 o'clock hour. So if we don't have any last minute questions or comments, I think we will call it a morning. So thank you everyone for joining, and especially to you, Jennifer, for your incredibly comprehensive report and thorough research that you did. And we just appreciate you being here and part of the community. Thanks.
Thank you, Colleen. Thank you, everyone. Have a great day.
Have a great morning. Bye-bye.